Gotta go, gotta go, gotta go. Gotta go. A urinary tract infection, otherwise known as a UTI, can affect any part of the urinary tract, including the urethra, bladder, ureters, or kidneys. A bladder infection is the most common type of a UTI. Approximately half of all women will experience a UTI in their lifetime. The female urethra is shorter than that of a man, which means that the bacteria can reach the bladder more easily. Bladder infections, when caught early, don't usually cause serious complications, and they are easily treated with antibiotics. If not treated, however, they can lead to kidney infection. Symptoms of bladder infections include a burning feeling while passing urine and frequent or intense urges to go to the bathroom, even if there is not a lot of urine to pass. Some other common symptoms of a UTI include pain in the bladder, groin, lower abdomen, or pelvis, foul-smelling urine, cloudy urine, dark urine, incomplete sense of bladder emptying, fatigue, fever, and cramping. There has been a recent study by Dr. Yair Lotan from the Simmons Cancer Center at the University of Texas Southwestern in Dallas. In this study, it compares the water intake and frequency of bladder infections. The study had the participants report their usual daily volume of fluid. This was approximately 6 8-ounces of glasses per day. The scientists divided the volunteers into two groups and instructed one group to stay at their daily intake and one group to consume at least 1.5 liters additional each day. This study was conducted over a 12-month period and had a couple different findings. In the additional water group, scientists found that 93% had 2 or fewer bladder infections, and while 88% of those in the control group had at least 3 or more. Overall, bladder infection incident in the water group was around half of that in the control group. So 111 of people who drank the extra water reported having 1 compared to 216 people who did not drink the water. The overall time period between bladder infections was about 85.2 days for the control group compared to 142.9 days of those in the water group. So the people in the water group experienced less bladder infections than the people in the control group. Those in the water group were half as likely to experience a bladder infections. These findings are important because more than half of all women report having bladder infections, and if we all can drink a little bit more water than we should to reduce our UTIs. In another study conducted by Dr. Thomas Hooton at the Division of Infectious Disease at the University of Miami School of Medicine, he says that drinking water is an easy and safe way to prevent an uncomfortable and annoying infection. In this study, he says that 25% of women will have more than one UTI, and that 60% of women will have at least one UTI in their lifetime. This is because the urethra in women is shorter, so it is easier for bacteria to travel from the rectum and the vagina to the bladder. This study involved 140 healthy women under age 45 who had experienced at least 3 UTIs in the past year and typically drink less than 6 8-ounce glasses of fluid a day. Half of the women were told to drink an extra 6 8-ounces of water a day, and the other half were instructed to make no changes in their water consumption. After 1 year, the women who increased their water intake had on average about 1.5 UTIs over the course of the study, compared to about 3 UTIs on average for the women who didn't increase their water intake. Most of the UTIs were caused by E. coli. In total, the women in the water group were drinking about 11 glasses of water a day compared to 5 glasses in the control group. Drinking more fluids is thought to reduce the risk of UTIs because it increases the rate at which bacteria is flushed from the bladder and also reduces the concentration of bacteria that enters the bladder from the vagina. This means that there are fewer opportunities for bacteria to attach to cell linings in the urinary tract. As a result of having fewer UTIs, the women in the water group also took less antibiotics. On average, women in the water group took about 2 courses of antibiotics compared to 3.5 courses in the group that didn't increase their water intake. This helps reduce the antibiotic resistance.